This MetaSynced video will focus on the transthoracic standard parasternal long axis view. This is taken directly from Echocardia, the echocardiography resource. A link to the website will be provided in the description below. Introduction, Proposition. Most investigators start the echocardiographic examination with the parasternal long axis view. The probe with the light, index, or dot points towards the right shoulder of the patient around 11 o'clock and is placed at the left lateral border of the sternum. Most often an image with good quality can be acquired in the third or fourth intercostal space or one intercostal space above or below. The patient should be placed in the left lateral decubitus position. Ideally, the left arm is lifted up with the head lying on the left upper arm. This leads to an extension of the costal arch, enabling a larger acoustic window. This diagram demonstrates the cross-section analogous to the parasternal long axis plane. This figure shows the anatomical specimen cut along the corresponding transthoracic standard parasternal long axis view. We have the ascending aorta, the interventricular septum, the right ventricular outflow tract, the left ventricle, and the left atrium. In this diagram, the tomographic cross-section analogous to the parasternal long axis plane of the two-dimensional echocardiogram is shown. This view enables inspection of both inflow and outflow of the left ventricle, particularly the left atrium, the mitral valve, the left ventricle, the interventricular septum, the aortic valve, and the ascending aorta. This is a echocardiographic transthoracic parasternal long axis view movie. Please note that the left ventricular walls seen in this view are the anteroseptal wall and the posterior wall, also named the inferolateral. The anteroseptal segment should not simply be named septal and mixed up with the inferoseptal segment seen in the four-chamber view. Using 2D measurements or M-mode echocardiography, the thickness of the anteroseptal and posterior wall can be determined. These are the visible structures, again in still frame, along the transthoracic parasternal long axis view. Utilizing color Doppler over the left ventricular outflow tract, aortic valve, and aortic root, we can check for aortic valve regurgitation. The box should be quite narrow to have a resulting frame rate of minimum 15 to 20. Note that in the clip above here, a severe aortic regurgitation due to aortic valve prolapse is visible. The same can be done with a color Doppler over the mitral valve to check for mitral valve regurgitation. Keep in mind that the box has to extend in the left atrium both in the antero-posterior and inferior septal direction. Only that way eccentric jets can be visualized too. Try to keep the frame rate at 20 even in this setting. The following clip demonstrates a severe eccentric mitral valve regurgitation with a frame rate of 22. This is an illustration drawing cross-section, again of the parasternal long axis view. We have the aortic valve, the ascending aorta, the left ventricle, the septal wall, the posterior wall, the mitral valve, the left atrium, and the right ventricular outflow tract.